everyone, my name is Destiny Williams and I'm a nursing student here at Wesleyan. I am going to do my demonstration speech on taking a manual blood pressure. Taking a manual blood pressure is important because if it's determined that you have high blood pressure, you're at risk for heart attack and or a stroke. A normal blood pressure reading is 120 over 80 millimeters of mercury. When you have high blood pressure, it puts extra strain on your arteries in your heart and causes the blood pressure to rise above the normal reading. While you may never have high blood pressure, it's important to know how to manually check a blood pressure in case you need to do it for someone else. This technique is impressive because it looks much harder to do than it actually is, and it can actually save someone's heart, their brain, or even their life. In order to take a manual blood pressure, you'll need to know the necessary equipment, how to prepare the patient, and how to actually measure that blood pressure. First, let's discuss the materials you'll need before you prepare the patient and take the measurement. Taking a blood pressure becomes a lot harder if you do not have the right equipment. To begin, you'll need a stethoscope, the proper sized blood pressure cuff, which is dependent on the size of the patient's arm, and an aneroid or mercury column sphygmomanometer. When choosing the proper blood pressure cuff, wrap the cuff around the patient's arm and use the index line to determine if the patient's arm circumference falls within the normal range. If the cuff is not within that range, you're going to choose a smaller or a larger cuff, depending on the patient's arm. Next, let's review the different parts of a blood pressure cuff. You have the actual cuff, the rubber tube, the gauge, and the bulb. The inflatable cuff, or the outer arm jacket piece that fits around the arm, tightens as the pressure begins to seal the vessels in the arm, bringing the pressure to a key point for the reading of the systolic or top number in the blood pressure reading. Like earlier when I said 120 over 80 is normal, 120 is that top number, which we know is systolic. The pressures of the cuff drop when the reading tapers off to the diastolic, or the lower number, which is the last beat heard through the stethoscope placed over the artery on the inside of the arm over the elbow. So the 120 is that top number, the 80 is the bottom number, which we call diastolic. The rubber tube connects to the gauge and cuff and holds the air as it becomes pumped into the cuff from the bulb attached to its end piece. The gauge contains the dial with a pointer that indicates the top and bottom parts of the reading of the blood pressure. The pointer circles around the numbers on the gauge and visibly depicts the upper and lower numbers as they pertain to the blood pressure reading. The bulb is attached to the blood pressure cuff and works to pump air into the cuff. As the bulb is squeezed, air pressure builds up in the cuff, which makes it tighten around the arm so the gauge can read the blood pressure. The bulb also contains a pressure release valve that holds the cuff pressure steady, then allows the person taking the reading to release the air pressure. To take the blood pressure, you will need to prepare the patient. So what you're going to do is explain what you're going to do to that patient. Take their blood pressure. You're going to place the appropriately sized blood pressure cuff on the patient's arm. Before you start taking the blood pressure, ensure that the sphygmomanometer is at 0 millimeters of mercury, so in between this box. If it's not, then it's not going to give you an accurate reading. Now that you have the equipment and you have prepared your patient, you're ready to take the blood pressure. Make sure the patient is sitting in an upright position with their feet flat on the floor and they cannot cross their legs. Ensure that the arm is positioned so that it is level with the heart. If the patient has on excess clothing, ask them to remove it. Multiple layers of clothing or heavy clothing can make it not only difficult to hear that reading, but it may also give you a false reading. Position the blood pressure cuff on the arm so that the artery marker is pointing to the brachial artery, which is just below the bend in the elbow. Position your stethoscope in the crease of the arm below the blood pressure cuff. Make sure the valve on the bulb is closed to allow air to inflate the cuff. Slowly begin inflating the blood pressure cuff. Inflate that cuff to 180 millimeters of mercury. However, if the pulse is heard when you get to that 180, you're going to have to go a little higher. Slowly begin to deflate the cuff by releasing the valve. The American Heart Association recommends that the pressure should fall at 2 to 3 millimeters of mercury per second. The first sound you hear, the heartbeat, is the systolic or top number of the blood pressure. Continue listening. When the sound fades, this is the diastolic or bottom number. Open the valve all the way and allow the cuff to finish deflating. Remove the cuff from the patient's arm and document your blood pressure reading. To ensure accuracy, you can recheck it. The patient may want to keep a record of blood pressure readings to share with their healthcare provider. The documentation will show trends in the patient's blood pressure and give a further look into a diagnosis if needed. To summarize, I've shown you the appropriate materials you'll need as well as the process for taking a blood pressure measurement. You may never need to take a blood pressure measurement, but you can never go wrong when you may possibly save a life. Thank you for your time today.